is still a stigma in the United States about having a diagnosis of depression or anxiety. I think because Hollywood has made it popular for movie stars to have the disease and see a psychiatrist and be on the medicines, that people are okay with accepting that they take medicines just like the people in Hollywood. But when it comes to any behavioral health disorder, medicines are temporary to get you back on track or to help you dive into the true therapy, which is always going to be behavioral therapy. Cognitive behavioral therapy, relaxation therapy, introspection usually should be done with a third party. Kind of like somebody who has a problem with alcoholism or alcohol. If I allow that patient to just get rid of the alcohol and make the lifestyle change on their own, the likelihood is high that failure will usually happen. Same thing with behavioral therapy or behavioral disorders. If somebody is having a baseline problem with a reactive depression, just say any form of depression, whether it's postpartum depression or you just lose a parent over the summer. During the winter months, especially in Chicago when it starts to get colder and darker, seasonal affective disorder usually sprouts up. So an average person might be able to deal with that, but if you come into winter with those problems that I just mentioned, the likelihood is high that you're going to feel it this time. And again, instead of waiting till it happens and taking a chance, sometimes it's better to just get started on things that will help get through the winter. Maximizing on circadian rhythm, maximizing on sleep would be so important. Anybody can do it. I think in society we sometimes push off sleep. We learned it from college, do all-nighters and make it up the next day, and it's a bad habit. I think circadian rhythm and being regimented about what time to get to sleep and what time to wake up is always useful for brain rest and emotional rest. So that would be the first thing. Second thing would be to eat a proper anti-inflammatory diet, as Andy Weil always points out. So maintaining the diet, the proper diet for the season is important. Ayurveda talks about eating and taking advantage of the food of the harvest, or the harvest is always in your area. So whatever's growing in your area should be able to help you beat or deal with the disease that's coming up in your area. So buying processed foods, taking in excessive amounts of alcohol, probably not the good things to do. Buying foods that have been imported 2,000 miles away, picked before they actually become ripe, probably not the best things to do. This is a delicate topic and usually needs to be better elucidated with the help of a nutritionist or a registered dietitian. But I do suggest that there are a couple things that you can do. Again, I love St. John's wort. I think it does help get through the winter time. It kind of depends on the patient. It's not for everybody. There are other things such as SAMe, 5-hydroxytryptophan, even just using things at night such as valerian and hops, or in the morning such as rhodiola. All these things help. These are all herbs that help to stabilize mood, especially when the wintertime comes. So it is important that we use medicines or herbs to stabilize. It's very important to consider counseling and therapy. It's usually either well accepted. 50% of my patients will accept it and say, I'll try it. The other 50 will say, I do not want anything like that. Until I tell them what it's about, and as I explain the use of behavioral therapy as far as relaxing, bringing out the relaxation response to neutralize the stress response, then people start to think of it as, oh, I need that. Most of us, as my lecturers will always point out, most of us are not taught how to develop the relaxation response. We are all taught, though, how to be really good at the stress response. I think business and society is telling us that if we're really good at being aggressive, you'll get to the top. And you might get to the top of business, but you'll also have about 2 heart attacks, the beginning of cancer, and a family that falls apart in addition to overuse of alcohol. So I really think that there's other things to do instead of just relying on stress response and cultivating it, actually bringing out and cultivating the relaxation response. The work of Deepak Chopra, Andrew Weil, even Herb Benson in Harvard actually coined the phrase, the relaxation response, back in the 70s, but we still have many doctors coming out of medical school that don't know about how to develop this or how to utilize this, almost to the degree of a response being equal to the use of Zoloft, Prozac, Paxil. And that's just with breath control, breath awareness meditation, and relaxation.